So one more time, good afternoon and congratulations with this for the International AIDS Society and for the Union of Equity and Health for organizing such an important event and such an useful event. Useful because for many years the HIV epidemics continues to be the same at the same level, despite the fact that we do have anywhere in the country diagnostic tests, both in public and private medical institutions. Speaking about the treatment, as the State Secretary mentioned, if some 2 years ago we could have offered antiretrovirus treatment only in Belska Hall and Chisinau, speaking about the right bank of Dnistru, but now since like lately, in 23 districts of the country, it is possible to offer this antiretrovirus treatment. Despite this, there is an underdiagnostication from 20 to 30% of people infected with HIV do not know their positive status. Slowly, I would like to move to this session and to discuss what could we do, what else could we do, what innovative methods we have. And I have the honor here to have practical practitioners in the panel who in our country and in our country in Moldova implement technological solutions for this. And I will start with Mrs. Maria Malachova. She's project manager in the Alliance for Public Health in Ukraine, specialized in the science of implementing digital innovations. As such, she is coordinating innovation projects meant to improve access to healthcare services for the vulnerable population. A notable example is the twin digital assistants, presented also during the conference held this year in Munich, which offers support and information to people affected by HIV. And I have a question to you. How is the system improving the accessibility to services for vulnerable people, and for which other challenges with its use?
Thank you, Alexandru. Is it working? Can you hear me? Okay. Not very well. Okay, I'm just waiting for something to pop up on the slide behind me, so I'm looking back. Yes, I'll just really quickly say what is Twin, and to be honest, I'll be speaking about it, but the best way to really understand what it is to actually check it out. So there are a couple of QR codes behind me. There is an English, Romanian, and Russian version for you to check out. The Romanian and the Russian versions are just for the demo purposes for today, so it can be a little bit, not perfect. So basically, Twin is a digital assistant. It is an AI-based digital human who is sought to support both clients and service providers with information and with a referral system to existing services. When we just started out working towards developing it, we were referring to it as a virtual social worker. But as we developed the concept, as we started talking to different stakeholders, carrying out focus groups and so on, we decided to step away from this name for the solution, as we will never really replace the social workers. The real social workers who are invaluable to the response. But we can support them and help them in any way we can and we should. Twin is a source of information in a way of asking and answering questions in both written and oral form. At the moment, it's accessible through a browser. So basically, a client can go online from any device, mobile device or computer, anything with access to internet, enter a question or say it out loud, and get a response generated with the help of AI, but not from like a general source like GPT or something like that, but from a structured, expertly kind of combined database of reliable evidence-based information. It's like instead of Googling, you can basically talk to Twin and get answers to any of your questions in any time, anywhere, right? Who are the people behind Twin? So when you go on the website, you will see that we have several consultants available right now. In Ukrainian, it's 4, and in English, it's 2. And why it's called Twin? So twin in English is, brother or sister, right? A sibling who is identical. Basically, it's a relation to a peer consultant. So at least two of the people who are our faces behind the digital human, they are real-life peer consultants who work in Alliance for Public Health and partner organizations programs, and who are social workers or outreach workers, case managers, and who can be even recognized by their clients, but accessible during the night and wherever, whenever. Kind of overall thematic coverage of the solution is pretty broad. It's quite comprehensive, but it is also very flexible and easily adjustable. So basically, through not very complicated and not very long processes, Twin can start speaking any language, look like anybody who we know or who we want him to look like, as well as, so it can be in person from any ethnicity, any background, anyone who we can access to generate the digital assistant, as well as in terms of the content. So basically it can know as little and as much as you like. So at the moment, the one which is being piloted in Ukraine, it covers everything in relation to HIV, preliminarily, right? So HIV testing, prevention, treatment, but much broader. So we go beyond HIV and we cover topics which are relevant to our key populations, all of them. So anything that can be of interest or of use. And if we go back to Alexandru's question, so how it is actually improving access and enhancing the response, we are hoping that we can reach with Twin not only existing clients and help support social workers in terms of taking off some kind of load from them in terms of time, in terms of energy, and kind of giving to them some easier tasks like educating clients and sharing some basic things, but also reach new clients, new people. And in terms of this, I can refer back to several sessions before where people talked about how important it is to make things about the person, to make how important it is to make it visually appealing, and and reaching people through the relevant channels where people are. So as I said, we are just piloting. We are doing anything and everything, and sometimes every day some new strategies of how to find the people born, and analyzing it all and trying to make it better as we go along, including for our upcoming, hopefully, pilot in Moldova the next couple of years. I can see my partner, colleague, good friend Konstantin, who's going to talk after me. He'll probably mention the application My Life Plus, which they are developing as part of Positive Initiative's strong digitalization process in the country. We are really hoping that we can collaborate and integrate Twin into the app as well. And yeah, we are open to any kind of collaborations, improvements, developments, co-developments, and scale up. Thanks.
Maria, mulțumim. Constantin.
Thank you. Konstantin didn't say that we will probably have soon implemented this app. It's a very interesting app. I have tried it myself. It's not an app actually, it's an AI. But you can ask this app any question and it will answer in the context of HIV. I didn't try to ask questions in our context, but in the context of HIV it's very useful. And it keeps confidentiality and can answer everything. It's very good. So the next speaker, I would like to introduce Mr. Milos Stojukovic-Rolovic. He represents the DOC company. And he has a broad experience of 2 decades. Since 1999, he started his activity in this domain, and he worked for the IPEER network, UNFPA, the United Nations Agency. He's performing training courses for leaders and trainers of peer-to-peer workers. Mr. Milos was general director of the largest youth movement of Serbia called Dance for Life, and he's an active member of the National Commission Against AIDS and TB from Serbia. Mr. Milos, I know that you have developed some mobile apps in Serbia. Could you tell us, please, more about them? And what was the impact of these apps on the HIV phenomenon?
Thank you, first of all, for having me here. And yeah, when COVID struck and everything was in lockdown and everything went digital, that's when we realized that we need some secure platform through which we can communicate with our clients, vulnerable groups, vulnerable people. So basically what we wanted to do is that we wanted to develop an app through which that app is completely encrypted, and it's going to provide secure place for the people in need to communicate. So on one side, we gather the outreach workers, healthcare providers, healthcare workers, psychologists, and also human rights activists. And on the other hand side, we have the clients who can download the app, actually open the profile, which is completely anonymous, and that client can actually select to which counselor he or she wants to communicate with. And the app also has the geolocation, so you can choose if you want to communicate with the person who is like next to you or working with the NGO that is in your region of Serbia, or you would prefer to work with somebody who is as far as possible from you, because you are still facing stigma and discrimination in smaller areas. So basically you as a client can choose, and all of the outreach workers, they have their profile picture, their short description, they have their field of expertise, and to which NGO they're part of. And we have also the quality control for those healthcare providers, actually outreach workers. The procedure goes that anybody who wants to be on the platform has to send application to TOTS, and then we have a team who is actually approving that and opening account for them. So basically everything is completely anonymous for the clients, and everything is the person-centered, actually client-centered, because we are there for the clients. When we rolled out the application in 2022, we had 3 categories. So first category was counselors, so different counselors from VCCT counseling, etc. The second one was psychologists, psychological support, and the third one is human rights activists, like React movement. So basically people can also address and communicate with somebody if they are facing stigma, discrimination, or any kind of violence. And we rolled it first only in Serbian language. But when the conflict in Ukraine started, then we added English, Russian, and Ukrainian language, because a significant amount of people from Russia and Ukraine are settled in Serbia now. And but what we notice is also that all the people from Russia and Ukraine who are actually using the platform are writing us in English. So we're going to see what's going to happen there. As I said, I mentioned that it's you can use geolocation. So basically, you can download it here, but you're going to have to talk in Serbian or English with the people who are actually counselors. We were thinking also that the data shows us that the majority of people who are coming to the platform and using it are mostly using it for VCCT on HIV and AIDS, but also for psychological support, because mental health is in decrease in Serbia and all across the globe. The mental health issues are growing. The same goes in Serbia for general population and especially for vulnerable groups. So that service is also used. The service that is the least used is the human rights activists, and actually reporting stigma, discrimination, and violation of human rights is on the record low level in Serbia, for instance. So we'll have to work more on that one in the future. There are a couple of things that we need to improve there, like the option of live chat is not there, so you have a delay in between the communicating with the consultant or outreach worker. One more is that we are basically healthcare service providers dependent. What that means is that not all healthcare service providers that are on the platform are using the platform in a timely manner and properly. And that's why we wanna spread, and we wanna include youth centers, and we want also to include some of the UNICEF projects in order to reach youth at risk. And what is interesting is that MUR is the name of the application. That's actually an acronym from youth at risk. So basically, that's the shortest that I could share about the app. If you have any questions, I'm here.
Mulțumim, Miloš.
Thank you so much, Miloš. Well, about questions.
At the end of this, when everybody will tell. Thank you. Mai departe.
Thank you. So next we have Mrs. Iva Škoda. She's an activist for human rights, implementing the so-called chatbot for the youth living with HIV in Belarus. In 2018, Eva has founded the first youth initiative in Belarus, united youth living with HIV and activists, having implemented many projects focused on discrimination. In 2023, she was forced to leave Belarus, and now she lives in Germany and Poland. Mrs. Eva, what feedback did you get from the youth using the chatbot, this innovation? How did this impact their access to information and support services relating to HIV?
Hi. Thank you for the introduction. First, let me tell you what the chatbot actually is. It is a first ever digital platform to promote the topic of HIV and STIs. So, let me be honest, we had plenty of issues. Some of them were predictable, others were not. The feedback was very different. Chatbot by itself is in Telegram Messenger, the one which is most popular among young people in Belarus. We have created a character, visualized it, the character that talks to people who get into chatbot. Unfortunately, it's not artificial intelligence. So you can't ask questions freely, but there is a list of questions and sections where you can access and talk to the chatbot. Our goal was to create such a character that will speak the same language that young people speak, and would do this humorously, gently, friendly, and we did achieve that objective. In terms of the feedback, we have received a lot of positive comments saying that this looks very progressive. Many have said that when they use the chatbot, they smile because we have integrated various jokes in the conversation with the chatbot on serious things. I also forgot to mention that we provide information about HIV and STIs, and we also provide free psychological support to people who live with HIV, and also legal consultations on HIV policies in Belarus and Poland. On our team of lawyers, we have people who know the legislation related to HIV in Poland. Many Belarus people who live with HIV emigrated. And we intend to provide such consultations about Poland and other EU countries. Now about the feedback. Many have mentioned that it is very important, the fact that we are promoting information about PrEP through the chatbot. And we are speaking in a very accessible and clear language about it. And among young people, we had 34 participants, young people who live with HIV, and 60% of them have said that they do not know what PrEP is and they never heard about it, and 20% have said they heard about PrEP but they have no idea what it is and how to get it. In Belarus, you can get PrEP free of charge, but it's difficult because you have to prove that you really need it, but it's possible. And many people have said that it has indeed changed their life, the fact that they learned that there is PrEP, because chatbot has been developed for young people who live with HIV and people who live with HIV, as well as for their relatives. We have information developed by psychologists as to how to support your relatives, how to explain to the child that he or she has HIV. And many people have said that they've learned about PrEP through the chatbot. And this has had an impact on their safety and made them think about the fact that they might need it. And we were supposed to provide consultations on HIV legislation in Belarus. In Belarus, HIV is criminalized practically. We have an article in the criminal code about infecting with HIV, and many people have been sentenced based on that article. Ira, I'm very sorry, but we have very little time available. Please, could you finalize? 1 minute. There is the law in Belarus, there is criminal code in Belarus, and people cannot protect themselves. And the difficulty that I've mentioned from the very beginning that we are working with We are trying to understand how to act under such conditions. It's all related to the context of Belarus. And many people say that they are afraid to use chatbots developed by activists. They are afraid to access various kinds of links, and they are afraid. They think that the special services of Belarus may break in or hack this chatbot and see the personal data. The activists are persecuted for comments for the subscription for chatbot, and they end up in prison for 2 or 3 years. And that is a challenge for us. We need to think about how to provide innovation.
Thank you, Eva. Next, I would like to introduce Mrs. Maya Rybakova. She is coordinator in the National Program for HIV and AIDS and Sexually Transmissible Diseases in the Republic of Moldova, my ex-colleague, and she is supervising the activities of prevention and control of HIV and AIDS at the national level. I know that for some 2 years, you implemented the so-called vending machines, mentioned today by Galina Lishko as well. What benefits does the installation of this vending machine has, and what barriers did you face in the installation?
Thank you so much for the question. Before talking about benefits and impediments, I will provide short information as to how we ended up installing them and providing services via vending machines. How many we have, where they are located, you will know all these dates, and then we will be able to speak about benefits and impediments. Until 2021, we had a project for the distribution of consumables via drugstores. And this project allowed permanently, continuously, without an interruption, 24 hours, 7 days a week, to provide the beneficiaries consumables based on the groups. We selected the biggest drugstore with the biggest number of subsidiaries, and the beneficiaries used to address them to receive consumables. Unfortunately, this project lasted until 2021. This experience stayed with us, and we wanted to continue such method of providing services so that the beneficiaries are not linked to the outreach workers, but so that they have permanently access to items, especially consumables. We tried to implement this method of service provision to provide consumables using vending machines. This project started in 2022. In 2022, we purchased some of the vending machines, and we started piloting the service. And during 2022 and 2023, we purchased 30 vending machines. And during 2023, we have installed them all. So this process, I would say, not quite a long one, but nevertheless it lasted some time. And we initially selected, we purchased 30 vending machines. Then together with non-commercial organizations within our technical groups, we selected locations where to install the vending machines, because locations had to be negotiated with the local public administration. So we have selected the locations and the NGOs that would be responsible to maintain, maybe, or basically to organize the community so that this activity is performed without any interruption. In order to negotiate this with local public authorities regarding the localities, we had to explain the representatives of local authorities the needs of these machines. We needed also to receive support from the Ministry of Health, from the Ministry of the Republic and Tiraspol Hospital. We needed this support so that we could argue the need of this service. And we had support from the Ministry of Health. We received a letter. The letter of approval, or maybe it was a letter to support this activity, and also the local authorities were quite welcoming. So basically went through all the impediments. Yes, when the locations were identified, the installation took place. We have 30 vending machines all over the territory of the Republic of Moldova, and 6 of them are in the Transnistria region, and 24 vending machines are on the right river bank. This year, from July 1st, we tried to install, actually to pilot the provision of these services in the penitentiary system, and now we have a vending machine installed in the penitentiary number 4. And now we have 27 people who have used these services. I beg your pardon for interrupting. So a big advantage is that beneficiaries have access to these machines 24 hours. Yes, you are right. The biggest benefit is that beneficiaries have access to services 24 hours. This service is anonymous, it's safe. And we, as a structure that monitors this service, well, this is the prevention service, we want to know the importance of the service, and for this we have to monitor the activity using our electronic registry. Briefly about impediments, well, these were not quite issues, but there were some questions in the start. During the installation process, we had questions with the local authorities. And again, questions were related to the location. We need to negotiate it. And we had some issues, but all the issues, all the challenges can be settled. Again, we had questions regarding the placement of consumables, regarding the distribution and monitoring, but we also have cases of vandalizing this vending machine. So these are the impediments. Thank you. Next, I would like to invite Mrs. Oksana Buzovich, and I beg your pardon for not having introduced you previously. She is the project coordinator within the Union for Equity and Health from Belts. She's working for quite many years to support vulnerable groups, including people living with HIV, drug consumers, basically key population. You developed a platform, a training platform. It's called formare.md, like training.md. Could you please briefly tell us how you maintain the data since permanently new data arise? How do you maintain this platform updated with new data? Thank you, Alexander, for the question. Welcome, everyone. Thank you so much for having stayed until our Q&A session. Briefly, I'll tell you the following. I know that many of you know this online training platform, and true, it's a digital tool that allows everyone to get involved, to learn new information, especially when it comes to health aspects, public safety, and I refer to the aspects related to HIV, to human rights, to communities affected. And what's new, we add training courses that also reflect the issues that arise during time, like violence and so on, referring to the groups we work with. But regarding the question asked by Alexander, well, initially we planned this platform be a viable one to display the correct information, and now we have huge opportunities. Even if we started everything during the COVID pandemics, we tried to join a huge team of specialists, and I refer to our partners, to both NGOs in the field, like GenderDoc, Promolex, and people from the ministries, from the Ministry of Health, from medical institutions. We have doctor specialists involved into the development of the training courses, and we are so happy that this is a platform not only for those who come to learn information, but also for experts who can provide their knowledge. So, with the help of the experts we involved, due to their expert knowledge, due to the new information they bring within various meetings, symposiums, within the conferences, these training courses can be adapted as much as needed to the newly provided information. Also, we practice piloting of the training courses, but with a smaller group of people. We launch the course, and within its piloting, we receive feedback from the participants, and we add information, we double check it, we revise key information, and the aim is to later improve the courses. Of course, our team is quite careful and attentive to the feedback from the participants. And I would say that the participants can be not necessarily the specialists from the harm reduction programs as we thought previously, but this is for any person that wants to have as much knowledge possible in this field. We are also extremely open to provide access to all the partners from the field who work in the healthcare and in the security sphere. I refer to the police sector, to the doctors and other specialists in the field. Thank you so much to all those who supported us in developing this platform. So I cannot leave without mentioning UNAIDS Moldova, UN Women, who helped our team develop such a resource for the specialists in the field from the Republic of Moldova, and later the past center, UNFPA, Ministry of Health, Ministry of Education, who were constantly with us in developing new courses. This is not where we stop. We promise you that soon after the launching of the training course regarding the violence, we will start new training courses. So we wait for you on our platform for Mari.md. Thank you. Thank you. The next speaker is online. I see Mr. Konstantin Cheranovsky. He represents the Initiativa Positive Association from Moldova. It's quite an active association in our country, and he is involved in various projects aimed to support people affected by these conditions. He also participated in the development of the so-called therapeutical communities that serve both as a rehab tool for people dependent on drugs and alcohol, and as a source for self-financing services. Konstantin, I know that you have a lot of digital solutions. Could you please tell us about some of the recent innovations that Initiativa Positiva is implementing in order to prevent HIV, definitely?
Hello, dear participants. Although Moldova is my homeland, but I am now in Austria, and I take this opportunity to connect to you online. Indeed, in our countries recently, these digital solutions have enabled more work, better approach to fighting HIV and AIDS, and Moldova is one of the leading countries for innovations in this field. Well, if I am to talk about our initiatives, so one of the key elements was with digital solutions, and actually our initiatives are complementary to each other. And everything started with a digital list, online list with profiles of customers. We connected vending machines, which helped the solution helped to monitor online. Also, the same system connected the medical equipment, like this triage cases, some primary indicators such as glucose, sugar, some primary indicators for our clients who cannot straightforwardly reach primary care. But such suitcases actually help them monitor their primary data. Another case is chatbot, which is helpful to promote testing, and also chatbot with referrals for risk groups. This is when active members of community invite other members of the community to take care of their health, and owing to rewards to those who invite and those who are invited, it actually increases the number of people who use these prevention services, and actually the number of people who access the services grows. Now we are in the initial stage of piloting of a mobile application, which is called My Life, and among its advantages that it offers a straightforward contact to persons in these target groups. It provides online services, access to information, so people will be able to find these services, and also access a lot of supplies they need. It will help them improve the quality of services in real time. They can also accumulate and get their medical results and tests. They will also be able to participate in research, give feedback, delegate members of their communities, voice their needs, and interact with those members of community who already represent them at different levels. And also share their opinions on different matters. And yet another activity which we are about to launch, these are terminals for the penitentiary systems, and through which these terminals will offer digital tool for interactions, and we will be able to collect feedback from the inmates. And Maria Malachova told you about this as one of the activities. So what I've told you is actually about what? Various systems appear which make services more comprehensive and place them online, which are more accessible. There are many more data used for management purposes. There are many data for analytics. And the next step is the data we can use to build forecasts. So we are working on early warning systems. Early warning systems for those persons who are on treatment but abandon it and can be infected, and so they will signal those people who require more attention. So the system also will ensure security and confidentiality of data. So this QR code is available, which will lead you to some data on prevention in Moldova, and in partnership with SOS and with this organization in Ukraine, we will provide a solution to access best practices, and the whole ecosystem of digital solutions. So it's actually great. It's best when systems start communicating between themselves. But then we face another problem yet, which is about confidentiality. So because about providing access to various parts of personal history, of personal record, and to make them available.
Da, sunt Svetlana Plămădeală, reprezint UNAIDS Moldova. Întrebări în special pentru cei care au elaborat anumite soluții digitale, da? Nu se aude. Acum se aude? Deci, pentru toți cei care au dezvoltat soluții digitale.
Those who have developed digital solutions, Well, the question is, what are the strategies to make everything sustainable? Because in the Republic of Moldova also went through the experience of developing applications, apps, and not always they are all viable. Thank you.
Да, я не вижу что-то. Я могу подключиться, начать от...
Well, I can start answering, by the way, and maybe my colleagues will join me then. So, it's actually a very good question. Yes, we have experience in Moldova for sustainability of solutions. This is assist for registration of services or prevention. Prevention program, and the holder of the system now, the system has been taken over by the agency which is responsible for monitoring, and they are now the holders of it. So it's a good question. It's a good example of sustainability. The problem with sustainability is that digital solution is economically more efficient than no such service. So as soon as we have this feasibility, then sustainability is no longer a real matter. It's just a matter of time. For instance, other approaches like unifications, this is when within certain certain activities are practiced which which encourage certain behaviors and reward for them. But this requires resources, because if you want someone to be tested, you need to spend on it on identification of this person, to reach out, to actually maintain them in the system. So through gamification, this process becomes more efficient. And also it improves sustainability. So I think it's moving towards the fact that a digital service will be equal to a real service. And then financing such service will also be no longer a debatable matter.
Thank you.
Thank you very much for your question. I fully agree with Konstantin, particularly the last paragraph, because when he's saying that the digital service will be equal to a real-time service, and the process we are moving now through, this is when part of our everyday activities have already been digitalized, and some of them not yet. So to track this process, to monitor this process and make conclusions, and therefore collect evidence to substantiate these activities, because anyway money is spent regardless whether it's a donor supported budget or a public budget. If we can prove the digitalization of certain activities or services will reduce spending or will save money, so that's already a good argument. Also, sustainability and cost effectiveness, these are the matters which must be taken account at the time yet of elaboration of a solution. What will be the technical platform to be selected? And this is important for data collection systems mentioned by Konstantin, and for the solutions employing AI or whatever, because expensive licenses, expensive subscriptions, all of this must be taken into account at the time when we are yet elaborating.
Okay, yeah, I definitely agree with the colleagues. There are two topics actually here. One is cost effectiveness, and digital tools are cost effective more than the programs without digital tools. So basically, you know, in order to provide outreach work, you have to go out to spend some time, meet people, etc., etc. And through the mobile app, that client can open their self-profile and communicate with the counselor or the human rights activist, the outreach worker, from the comfort of their home, if I may say it like that. On the other hand is sustainability, which is much more important there than cost effectiveness. And for the time being, all the counselors and outreach workers that are part of the mobile app and that are providing the services are also outreach workers for working in the non-governmental organizations that are sub-recipients of Global Fund and Ministry of Health grant. So we are quite safe on that side for some time in the upcoming years. And also, as I said, we want to involve the youth centers and other service providers who are also trying to find funds for their own activities. Basically, with this app, we are giving them the platform to reach more people than they would reach without the platform.
Thank you. I have more a reflection than a question. We were talking about the cost efficiency of apps and innovations, and this is very important. We were talking about the fact that these innovations should be sustainable. But there is one more very important component. These apps, they should be sensitive to those groups to which they try to approach. If you speak about youth, it's okay because youth use the new technology. The young people, they are involved in everything that means innovation and digital transformation, but we always should bear in mind that our groups are various. They are different by age. We should not forget about the people, the aging people, the elderly who may face some difficulties or maybe not difficulties, but we should organize some separate promotion and development for this elderly group. And we should not forget that HIV is present not only in urban area but in rural area as well. And we should think how we bring these innovations closer to this rural population. Where they are located. Of course, it's absolutely important to have a cost efficiency, because now when we develop the apps, we should think very well about the complexity of their applicability, and we should not leave anyone behind. We should ensure the equity of access to these services.